Hello, my name is Tashana, and I would like to discuss a major issue that the hospital faces, and it is called a hospital acquired infection, nosocomial infection, an infection that takes place once a patient is admitted to the hospital. They may come for a particular procedure, or they may have other ailments going on, but they acquire an infection from the staff. And that comes from not properly washing your hands, not using PPE, leaving another patient's room, entering the next patient's room, not properly cleansing hands, touching patients, and the cycle continues. Because once it starts, it's like a cycle and it keeps going. And that's one of the major issues that the hospital have. This situation, however, needs to be addressed because not only has it been a major problem, and it hit home within my situation as well, as far as a loved one that had passed because of that, particularly after surgery, and they go to the recovery room, and you're pretty much fragile. Everything need to be clean, and they develop staph, MRSA, and this comes from staff members. So as far as management, the head nurses of the floor, they need to have more in services. They need to monitor their halls. They need to take this situation very serious because it causes lives, and it not only affects the patients, it affects the staff. And when it affects staff members, you have a low number of staff available to work. You have the other half out sick, and there goes patient staff ratio. They're not getting the proper help they need. It'd be a rush. So, the moral of this scenario, if upper management enforce this major problem, which is a major problem, and it needs to be addressed first, because as every hospital, healthcare all around the world, the number one thing is safety first. And once you have that safety, once you have the cleanliness, once you have a clean environment so that you can properly do your patient care, and everything will go as it should. Okay? But if a patient come in for one problem and they leave on top of another problem, and then the cycle of the infections circulate throughout the hospital, and it may go to your home, and that's how infection starts. So that's one of the major issues, a major issue within the healthcare field. And I think that it needs to be addressed. Not only at a local hospital, I work in healthcare, I work in hospice. And even though I take care of hospice patients, safety is important everywhere. And especially during this time now, because of the pandemic, it is so much going on. So one thing that we need to just take in consideration is proper hand washing, cleansing things down, utensils, everything, because our lives matter. And just simple as washing your hands, cleaning down surfaces, cleaning bedside tables, properly putting utensils in the hospital in their proper places so that they can be either sterilized, thrown out, put them in hazardous waste bags, whatever the situation is. You just have to just take your time and do the right thing. And always have in the back of your head, always, safety first. Always. Whether you're in a hospital or at home, because walking from home into the hospital, you can bring infection in. So, as a reminder, these things needs to be addressed. It starts with hand washing, the proper hand washing technique. A lot of people say they can wash their hands, but it's a technique, at least 20 seconds. Scrub them down. Just make sure that not only you're safe, make sure that the person that you're taking care of is in good hands, because they come to you all to get the proper help they need, and they deserve